Missouri continues to top the national averages for new COVID cases as the faster spreading Delta variant has St. Louis leaders worried about those still not vaccinated. 5 on Your Side has learned Governor Mike Parson is considering new incentives to encourage people to get the shot. Thanks for joining us. I'm Mike Bush.
And I'm Kay Quinn. Our Casey Nolan looked into it and found incentives could have the opposite effect in some communities. Casey?
Mike and Kay, Missouri is near the top of the list for states with the highest rate of new COVID cases and in the bottom third when it comes to vaccinations. That has health leaders worried and debating what is the best message to the public.
As tracked by the New York Times and other national outlets, Missouri continues to make headlines for leading the country in new COVID cases by population, with the virus spreading nearly 5 times faster than the national average. In southwest Missouri, COVID is spreading in one county at nearly 10 times the rate as it is in St. Louis.
The good news is for our state, well over 80% of the people that are the most vulnerable has had the vaccine.
But the bad news, say health officials, is the number of people unprotected from the more contagious and more serious Delta variant of COVID-19. Statewide and in the city, fewer than 40% of people are fully vaccinated.
And we realize that not everybody's going to want to take the vaccine. But you also have to understand this virus is not going away. So the many people we get vaccinated, the better off we are. So we're going to keep promoting that.
Governor Parson's office and the state health department confirm they are working on statewide incentives to encourage more people to get inoculated.
We could have essentially a repeat of what we saw at the beginning of the COVID-19 pandemic in the city of St. Louis.
But the head of the city's health department says incentives may have the opposite effect in minority communities where vaccination rates are already lower.
It could be due to misinformation. It could be due to individuals' personal experience with the medical community or even with government. And so we have to be mindful of that. We don't expect things to happen overnight, but we are dedicated to doing our very best to reach as many people as possible and to make sure that every city resident has access to accurate information so they can make the best decision.
And to that end, the city is working with community organizations and even beauty salons and barbershops to share accurate information about COVID vaccines. Dr. Eccles says he's not against incentives altogether. The city has partnered with the Cardinals, for instance, to give away tickets to people who get their vaccine. And he says more programs could be in the works. Okay.
All right, thanks, Casey. So we want to know, how concerned are you about the Delta variant? Take a look. 35% of you say very concerned, 30% of you say somewhat concerned, and 35% say not at all. Let us know how you feel at ksdk.com/vote or on the 5 on Your Side app.